Imagine being suddenly gripped by overwhelming terror. Your heart races uncontrollably, your chest tightens, you can't catch your breath, and you're convinced you might be dying. Then, just as mysteriously as it began, it passes, leaving you exhausted, confused, and fearful of when it might strike again. This is the reality for millions of people living with panic disorder. Welcome to our exploration of panic disorder, a condition that affects approximately 2 to 3% of the global population, yet remains widely misunderstood. Over the next 12 minutes, we'll delve into what panic disorder truly is, how it differs from occasional panic attacks, its symptoms, causes, and most importantly, the effective treatments and coping strategies that can help those affected reclaim their lives from the grip of panic. Whether you're personally affected by this condition, know someone who is, or simply want to understand this aspect of mental health better, this video aims to provide clarity, compassion, and practical knowledge about panic disorder. Understanding panic disorder. Panic disorder is more than just experiencing occasional anxiety or nervousness. It's a specific type of anxiety disorder characterized by recurrent, unexpected panic attacks followed by persistent worry about having additional attacks or significant behavioral changes related to the attacks. A panic attack is an intense surge of fear that triggers severe physical reactions despite no real danger or apparent cause. These attacks often feel like medical emergencies to those experiencing them, with many people initially believing they're having heart attacks or other life-threatening conditions. What distinguishes panic disorder from experiencing isolated panic attacks is the ongoing fear of having another attack and the lifestyle changes made to avoid situations that might trigger them. This fear of fear creates a debilitating cycle that can significantly impact daily functioning. It's important to understand that panic disorder is not simply being high-strung or too anxious. It's a recognized mental health condition with specific diagnostic criteria in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. While everyone might experience a panic attack at some point in their lives, panic disorder involves recurrent attacks and the persistent fear of their return. Symptoms of panic attacks and panic disorder. Panic attacks are the hallmark of panic disorder, and they typically include both physical and psychological symptoms that peak within minutes. Physically, individuals might experience heart palpitations, chest pain, shortness of breath, sweating, trembling, dizziness, nausea, abdominal distress, numbness or tingling sensations, and chills or hot flashes. Psychologically, there's often an overwhelming sense of impending doom or danger, fear of losing control, feelings of unreality, derealization, or being detached from oneself, depersonalization, and a frightening sense that one might be dying. What makes panic disorder particularly challenging is what happens between attacks. After experiencing the intensity of a panic attack, many individuals develop anticipatory anxiety, a persistent worry about when and where the next attack might occur. This often leads to avoidance behaviors, where people begin to shun situations or places they associate with previous attacks. For example, someone who had a panic attack while driving might stop driving altogether. Someone who experienced an attack in a crowded store might begin avoiding all public places. This pattern of avoidance can develop into agoraphobia, a fear of places or situations that might cause panic, helplessness, or embarrassment. The impact of these symptoms extends far beyond the actual panic attacks. Many people with panic disorder report difficulties maintaining employment, strained relationships, reduced quality of life, and higher rates of depression. The unpredictability of attacks and the subsequent hypervigilance about bodily sensations create a constant state of tension that affects nearly every aspect of daily life. Causes and risk factors. The development of panic disorder involves a complex interplay of biological, psychological, and environmental factors. No single cause has been identified, but rather a combination of elements appears to contribute to its onset. Biologically, there seems to be a genetic component, with panic disorder often running in families. Research suggests that abnormalities in certain brain areas, particularly those involved in the fear response, may play a role. Neurotransmitter imbalances, especially involving serotonin, norepinephrine, and gamma-aminobutyric acid, GABA, have also been implicated. Psychologically, certain cognitive patterns may predispose individuals to panic disorder. People who tend to catastrophize bodily sensations, interpreting normal changes in heart rate or breathing as dangerous, might be more vulnerable. Similarly, those with heightened anxiety sensitivity or the fear of anxiety-related sensations appear at greater risk. Environmental triggers can include significant life stressors, traumatic events, or major life transitions. Childhood experiences of separation anxiety or losing a parent have been associated with adult panic disorder. Interestingly, certain behavioral factors like smoking, excessive caffeine consumption, and drug use may also increase susceptibility. It's worth noting that panic disorder often coexists with other conditions, including other anxiety disorders, depression, and substance use disorders. This comorbidity can complicate both diagnosis and treatment, highlighting the importance of comprehensive assessment. Diagnosis and assessment. Diagnosing panic disorder begins with ruling out physical conditions that can cause similar symptoms. Heart problems, thyroid disorders, respiratory conditions, and certain medication side effects can all mimic panic attacks. This typically involves a thorough physical examination and potentially lab tests or other diagnostic procedures. Once medical causes are excluded, mental health professionals use clinical interviews and standardized assessment tools to evaluate symptoms. According to the DSM-5, panic disorder is diagnosed when a person experiences recurrent, unexpected panic attacks followed by at least 1 month of persistent concern about having additional attacks, worry about the implications of the attacks, or significant changes in behavior related to the attacks. Clinicians may use questionnaires like the Panic Disorder Severity Scale, PDSS, or the Anxiety Sensitivity Index, ASI, to help assess symptom severity and track treatment progress. They'll also evaluate for agoraphobia, which frequently co-occurs with panic disorder but is diagnosed separately. It's particularly important to distinguish panic disorder from other anxiety disorders, medical conditions, and substance-induced anxiety, as treatment approaches may differ. The assessment process should also screen for depression, suicidal thoughts, and substance use, as these can impact treatment planning and outcomes. Treatment approaches. Psychotherapy. Effective treatment for panic disorder often involves psychotherapy, medication, or a combination of both. Let's first explore the psychotherapeutic approaches that have shown significant effectiveness for this condition. Cognitive behavioral therapy, CBT, stands as the gold standard psychotherapy for panic disorder. This approach helps individuals identify and challenge distorted thinking patterns that fuel panic while gradually facing feared situations. A key component of CBT for panic disorder is interoceptive exposure, controlled exercises that safely reproduce physical sensations associated with panic attacks. By repeatedly experiencing these sensations in a safe context, individuals learn that the sensations themselves are not dangerous, reducing fear responses over time. Panic-focused psychodynamic psychotherapy explores how unconscious conflicts and early life experiences might contribute to panic symptoms. By gaining insight into these underlying factors, individuals can develop more adaptive ways of managing emotions and relationships. Acceptance and commitment therapy, ACT, teaches individuals to accept uncomfortable thoughts and sensations rather than fighting them. This approach helps people clarify their values and commit to meaningful activities even in the presence of anxiety, reducing the impact of panic on daily functioning. Mindfulness-based interventions, including mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, train individuals to observe their thoughts, feelings, and bodily sensations without judgment. These approaches help break the cycle of catastrophic thinking and fear of physical sensations that often perpetuate panic. These therapeutic approaches may be delivered individually, in groups, or increasingly through digital platforms. The format depends on individual preferences, availability, and specific needs. Treatment approaches. Medication and self-help. Medication can be an important component of panic disorder treatment, particularly for moderate to severe cases. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are typically the first-line medications. These antidepressants help regulate neurotransmitters involved in anxiety and panic and usually take several weeks to reach full effectiveness. Benzodiazepines may be prescribed for short-term relief of severe symptoms due to their rapid action. However, they're generally used cautiously because of their potential for dependence and tolerance. For some individuals, other medications like certain anticonvulsants or beta blockers might be considered based on specific symptoms and overall health. Beyond formal treatments, self-help strategies play a crucial role in managing panic disorder. Regular physical exercise has been shown to reduce anxiety sensitivity and panic symptoms, potentially by helping individuals become more comfortable with physical sensations like increased heart rate and breathing. Breathing retraining techniques teach individuals to counteract the hyperventilation that often occurs during panic attacks. By practicing slow, diaphragmatic breathing regularly, people can call upon these skills during moments of panic. Progressive muscle relaxation helps address the physical tension associated with anxiety and panic. By systematically tensing and releasing different muscle groups, individuals learn to recognize and release tension. Limiting substances that can trigger or worsen anxiety, such as caffeine, alcohol, and nicotine, can also be beneficial. Similarly, maintaining regular sleep patterns helps regulate the body's stress response systems. Many people with panic disorder benefit from joining support groups, either in person or online. These communities provide understanding, reduce isolation, and often share practical coping strategies. Living with panic disorder, beyond symptoms. Managing panic disorder extends beyond treating the acute symptoms. It involves learning to live fully despite the possibility of panic. Many individuals with panic disorder develop patterns of avoidance that gradually shrink their world, making recovery as much about reclaiming territory as reducing attacks. A key aspect of long-term management is exposure therapy, where individuals gradually confront feared situations with support and guidance. This might mean returning to places where panic attacks have occurred or engaging in activities that trigger anxiety. Each successful exposure builds confidence and reinforces the message that panic is uncomfortable but not dangerous. Relapse prevention strategies help individuals maintain progress even after formal treatment ends. This includes recognizing early warning signs, having a plan for managing setbacks, and continuing to practice coping skills even when symptoms are minimal. For family members and friends of those with panic disorder, education is crucial. Understanding that panic attacks are not dangerous, knowing how to respond supportively without reinforcing avoidance, and encouraging treatment can all make a significant difference. It's also important to address the shame and stigma that often accompany panic disorder. Many people feel embarrassed about their symptoms or fear being judged as weak. Challenging these perceptions and recognizing panic disorder as a medical condition, not a character flaw, is essential for both individuals and society. With appropriate treatment and support, most people with panic disorder experience significant improvement in symptoms and quality of life. Some achieve complete remission, while others learn to manage occasional symptoms effectively without substantial impact on functioning.